Hello, my name is Drew Hess. I'm one of the physician associates here at Sinus and Snoring MD, and today we will be talking about nasal septal deviations. So basically, within your nasal cavity, you have a septal wall that divides the two sides of the nose. All right, I like to think of it as a cartilage sandwich, meaning that one side is tissue, one side is cartilage, and then the other side is tissue. All right. Now, when that septum is deviated to one direction or the other, sometimes people can be symptomatic from it. It's actually a very, very common thing to have in your nose, but the question is it causing you symptoms? So what are some symptoms that you can experience? One of the most common symptoms is just nasal obstruction. So a lot of times if the septum deviates one direction, the direction that it deviates to is blocked more so than your other side. So people who say, I've always breathed better out of my right side versus my left side, that can sometimes be a cause. There's different degrees of septal deviation. The more deviated it is, obviously, the more severe your symptoms are. Meaning, are you breathing at all through one side of your nose, and has that been how it is your entire life, or is it just a little bit of obstruction? That's what further evaluation, or what we'll find with further evaluation if we see you here in the office. Other symptoms that people can have as well, basically, even though you have nasal septal deviation and obstruction in your nose, right, if it's severe enough, it can actually make you not be able to use your nose to its fullest potential and make you more of a mouth breather. Similar to one of our other videos, right, that can cause snoring with breathing through your mouth, and then, sleep apnea and things like that. So it's a contributing factor to that. Some people say that if it's really, really severe, it can actually give you one-sided facial pain. It can predispose you to having nosebleeds. One of the reasons of that is, right, when your septum's deviated, basically it's stealing room from one side. So on the other side of your nose, sometimes you have too much room, okay? So then basically, because of increased airflow through that one side, increased airflow can cause dryness. And drying on your septum is the most common spot for having frequent nosebleeds. So it's also another cause. Some other things that you can notice with septum deviations is when you lie down to sleep. All right, now when you lie down flat, everyone's nose swells a little bit. There's actually something called the nasal cycle as well, meaning that at any point in time, one side of someone's nose is preferential for breathing than the other. Now in somebody who has enough room in their nose, you don't really notice a lot of obstruction, but in somebody who has a septum deviation, a little bit of swelling on that side can block off that side completely. When you lie down also, blood flow increases in the nose, causing more swelling in general as well. All right, now, that's noticeable because sometimes when you lie on one side, gravity also goes to that one side and blocks off your nose too. So for some people, they say, hey, I can only sleep on my left side because my nose is so blocked if I sleep on my other side. So it's also a sign of septum deviation. Any other questions or concerns about nasal septum deviation, feel free to give our office a call. Otherwise, schedule an appointment with us here at Sinus and Snoring MD.